Hi, it's Dr. Clark. Talking to you today about overcoming brain-based problems. And today I want to specifically talk about brain waves, and I want to talk about neurofeedback. Some people have heard the term neurofeedback, or maybe they've heard biofeedback, and I want to explain that, how that works, and how that can help you get your brain functioning normally again. First of all, what are brain waves? Brain waves are simply this. They are the amount, magnitude, and frequency of firing of the neurons of the brain. Neurons, of course, are nerve cells. And so there are 4 brain waves that are noted in the brain. There's delta, there's theta, there's alpha, and there's beta. And they go from slowest delta to fastest beta. From as little as 2 times per second a neuron firing to 30 times a second a neuron firing with beta. And so these should be at certain amounts in each area of the brain. For instance, when you're sleeping, your delta should be the highest. But when you're awake, your alpha should be the highest and beta behind that. If you have a situation where your slower brain waves like delta and theta are high during the day when you're awake, and then your beta is low, that is a perfect scenario for ADD, ADHD, autism type problems. It's because the brain is working slow. It's going to have a hard time focusing, have a hard time processing. So how do you change that? Well, let me say this. The brain only does what it does right now because of what it's learned. And so these have become neurologic habits. And the only way to change that is to get the brain to learn something new. And so that is where neurofeedback can be very effective, because neurofeedback is basically rewarding the brain for changing itself. This is how we get the brain to change, is you reward the brain. In our office, we use a program of neurofeedback where you watch a video. And when the brain waves are coming to their normal ranges, the video plays, and you get to watch the video, you get to hear the sound. When the brain waves dysregulate and get out of range, the movie begins to cut out. The picture begins to go and the sound begins to decrease. At that instant, the brain will begin to then notice and recognize that it lost its reward. And it will instantly begin to change back. Once it changes back, the video picture will come back, the sound will come back, and over a period of time, the brain is retrained or retrains itself to fire at optimal levels. So this has been a very effective program for a lot of things, especially ADD, ADHD, autism, insomnia, depression, anxiety. As a matter of fact, you can look on the government's website, which is pubmed.gov, and you'll see all the research articles that have been published in America. And if you search there for ADD, for neurofeedback and ADD or anxiety or whatever you're looking for, you'll see literally dozens and sometimes hundreds of articles that have been done. There's almost 500 articles on neurofeedback treatment for ADD alone. So it's been around a long time. It's one of the most effective treatments that we have, and it's one of the longest lasting treatments. We actually have studies of people that were done 30 years ago with neurofeedback, and they still have improvement after 30 years. So it's pretty amazing that we can do that. So I hope this helps you. If you couple this along with other things, you can get your best improvement. God bless and have a great day.